Introducing Ipop, a simple, interactive pelvic organ prolapse model for medical learners and patients. Pelvic organ prolapse can be a challenging condition for patients and medical learners to understand. We designed Ipop to facilitate the understanding of prolapse by both patients and medical learners. This model allows for demonstration of prolapse as well as the surgical options for the treatment of apical prolapse. To build this model, you will need the following supplies and equipment. To begin, you will need a cardboard box. Cut a corner of the box to the following dimensions and secure the loose edges with tape. Cut out the following window. Designate the locations of the urethra, vagina, and anus using the following dimensions. Next, cut out each of these structures. To create the vagina, cut the end of a pantyhose to a length of 18 to 20 centimeters. Next, create a series of grooves around the face of the cardboard. Wrap the hose around the cardboard and secure using these grooves. This creates a vaginal length of 10 centimeters. Partially inflate a balloon to represent the bladder and urethra and insert through the urethral orifice. Next, create the rectum using a quarter of a toilet paper roll. Tassel the edges of the roll. Next, secure the roll to the cardboard box using tape to represent the rectum. Apply felt to the face of the cardboard box using glue. Once dry, cut out the holes for the urethra, vagina, and anus. To create the cervix, invert the hose and glue a bottle cap to the end of it. Then roll up a 2 centimeter wide piece of felt. Then glue the rolled up felt into the bottle cap to form the cervix. Once the glue has dried, replace the hose to the original position and stretch a balloon over the bottle cap to form the uterus. Glue a button to the side wall of the box just lateral to the rectum to represent the ischial spine. Then glue a strip of rough-sided Velcro extending from the ischial spine to represent the sacrospinous ligament. We cover the rough Velcro with its opposing side when not in use. Attach a piece of soft-sided Velcro to the right of the vagina at the level of the cervix. Thread a shoelace through the posterior vagina at the level of the cervix to form the uterosacral ligaments. Tape a full toilet paper roll to the superior aspect of the cardboard box representing the sacral promontory. Punch 2 holes just below the roll to thread the ends of the shoelace through. Use binder clips to secure the uterosacral ligaments to their desired laxity. Apply a piece of soft-sided Velcro to the paper roll to represent the anterior longitudinal ligament. To simulate sacrocolpopexy mesh, we staple together 2 pieces of 15 and 12 centimeter rough-sided Velcro. Attach a soft-sided piece of Velcro inside the toilet paper roll to hold the mesh when not in use. Attach soft-sided pieces of Velcro 3 centimeters from the hymen along the anterior and posterior vagina to indicate the AA and AP points on the POP-Q exam, as well as allow for sacrocolpopexy mesh attachment. Attach 2 clothespins anywhere on the model. These will be used later to demonstrate the uterosacral ligament suspension. Here we demonstrate apical prolapse with associated anterior vaginal wall descent. A rectal exam demonstrates a posterior wall defect. Here, we demonstrate a uterosacral ligament suspension by attaching the apex of the vagina to the ligaments using the clothespins. To simulate a sacrospinous ligament suspension, use the Velcro strips to attach the vaginal apex to the ligament. We can demonstrate a sacrocolpopexy by attaching the mesh to the vagina and the sacral promontory. We've had great experiences using this model to teach the POP-Q exam and to teach learners how to stage pelvic organ prolapse. We also use this model for patient education and counseling. We estimate the cost of the model to be under $5 and take approximately 30 minutes to assemble. We hope you enjoy using this model as much as we enjoyed creating it.